I'm Peter Block here in Chicago at ACC.16 for On the Scene, and with me is Peter Smith from Duke, Chief of Cardiothoracic Surgery. And Peter has been involved with the moderate MR trial, a trial that's now 2 years old. So Peter, I'm not going to spend a lot of time with the introduction here. Tell me what the trial initially was all about, and now we have a little bit longer follow-up, don't we?
We definitely do. I think this trial is trying to answer a really important question for cardiologists and surgeons as to what to do with the patient with ischemic MR that is moderate, whether to repair it or just do bypass surgery alone. At 1 year, the two looked completely equivalent. Patients all improved and did well, but 2/3 of the patients who had CABG only had resolution of their MR. At 2 years, this result is holding true. The moderate MR has been resolved in 2/3 of the patients with revascularization alone, and the repair is doing a little bit better at reducing the moderate MR, but we can't see any other indicators. The mortality is the same, quality of life is the same, New York Heart Association class is the same. So basically, we feel that adding mitral repair to all these patients would not be correct.
Wow, so that's a little bit of a deviation from what we initially thought about 2 years ago. Now we're getting a lot more data for that. So tell me, Peter, if I came to you and I had moderate MR, I needed a 3-vessel CABG, none of which was to the circumflex circulation, what would you do to me?
Well, that would be interesting. Obviously you have to individualize for these patients. The other thing that we found is that the ability to recruit regional wall motion in the posterior region of the heart has a big role in reducing the MR. So I would have to use a bit my judgment, perhaps a little bit in advance of the analysis, about how well your myocardium is going to respond to the revascularization alone, because it really does look like that's the dominant thing going on in these patients. The response of the heart, the remodeling that's related to CABG is what's really affecting the mitral apparatus, just for the moderate patients.
Well, it's interesting, in interventional cardiology, we always talk about stenting the circumflex and making the MR better. We rarely see it, and yet in surgery with a coronary bypass operation, it seems as though reperfusion does make a difference. That's an extraordinary outcome, isn't it?
It is. It's really a surprise.
Okay, thank you, Peter.